Welcome to another enlightening episode of The Truth About the Plant, the show that takes you on a journey through the world of psychoactive plants and alternative wellness, all while delivering those real, actionable insights that you crave. I'm your host, Christina Dees. This is my equally talented co-host, Dr. Amanda Ryman. Dr. Ryman, you get to do the honors. Tell them why we're here.
Well, we're here because it can be really, really hard to find evidence-based, actionable information about cannabis. You go onto Google, you're going to get 500 responses, many of which contradict each other, and you can spend hours trying to get to the bottom of it. We're here to answer your most pressing questions about cannabis safety, efficacy, and so you can just think of us as like your really cool aunties or your kick-ass granddaughters here to give you the truth.
Yes. And so welcome, Green Crusaders and Health Explorers. Today's episode is a prescription for curiosity as we ask the age-old question with our guest, the wonderful Peter Grinspoon, is cannabis a medicine? So join us for a dose of knowledge, a sprinkle of humor, and a dash of insight as we navigate the cannabis landscape together. So,
all right. Well, I am so excited for our guest today. We have Dr. Peter Grinspoon. He is a primary care physician and a cannabis specialist at Massachusetts General Hospital and an instructor in medicine at Harvard Medical School. He is also the author of a recent book, Seeing Through the Smoke, a cannabis expert untangles the truth about marijuana. And you know we love the truth about marijuana on this show. You'll find a link to his book in our social media posts, in our description on YouTube. And if any of these topics have been interesting to you and you want to dive a little deeper, he is definitely the person to bring you that information. So we're really excited to have Dr. Grinspoon today because we have a really important question. So, the Department of Health and Human Services recently concluded for the first time that cannabis actually has medical benefits, but it's still not considered a medicine by many health professionals. In the US, a medicine is very narrowly defined as an FDA-approved product. And due to its Schedule 1 status, what says it has no medical value, it has been nearly impossible to move cannabis through the FDA process. So, Dr. Grinspoon, is cannabis a medicine?
Cannabis is definitely a medicine. I knew from a pretty young age that cannabis is a medicine because my brother Danny, unfortunately, was fighting an unsuccessful battle with childhood leukemia. And in the early 1970s, my parents sort of illegally bought cannabis for him because they were so desperate. He couldn't eat. He couldn't hold down his food. He was just like lying in bed and throwing up all day because of the chemotherapy. And the effect on my brother was really remarkable. Like he was, he still had cancer and it didn't really help with the cancer, but his quality of life improved so drastically. He was able to eat. He was able to hold down medicine to maintain his weight. And most importantly to me, he had energy and felt well enough to come down and play with his little brother, so I knew from a very early age, probably like 8 years old, that cannabis was a medicine. And that sort of inoculated me during medical school where, now it's getting a little bit better, but they're still very, very old fashioned about cannabis in medical school. And, part of that's very complicated. It's the kind of the culture of the pharmaceutical industry has a big influence on sort of medical school curriculum. But the fact is cannabis has always been a medicine. They were using it 5,000 years ago, probably longer, but we have documentation from, these Chinese dynasties of how they were using cannabis as a medicine. And as we were just talking about before the show, it was placed on the U.S. pharmacopoeia in the 1850s as a legitimate medicine in the United States. And it was there for almost 100 years until after they criminalized cannabis, it was taken off the pharmacopoeia and wasn't for by the U.S. government, at least, considered a medicine. It is, as you mentioned, it's very difficult to get cannabis through the FDA process, not just because of the war on drugs, but it's a botanical product. It's a plant, and it has 500 different components in it, many of which are psychoactive. And, this is why some types make you want to go out to a party and other types make you want to just relax and so forth. They're different types of cannabis. And it's because it's such a complex drug with so many different components to it. So I've never doubted that cannabis has been a medicine. I've used it myself for migraines, for nausea, for pain after surgery. And I've been using it with patients for about 25 years. It isn't a cure-all. Some people can't tolerate cannabis at all. They get very anxious or they fall right asleep, or paradoxically it makes them nauseous. And, other people just aren't interested in it because it still has a big stigma. And, it's not legal in every single state. I know that two of us are from either Massachusetts or California, where it's very legal, but North Carolina, it's less legal, and that perpetuates the stigma. But what I would like to say is that for some of the most difficult to treat conditions that I treat as a primary care doctor, the chronic pain, the insomnia, the anxiety, that's exactly what cannabis can be a really effective medicine for. Again, not for everybody. And we like to start low and go slow. If you take too big a dose, it can make the anxiety worse. So we start with a very, very little dose and work our way up. But you look at chronic pain, what are the alternatives for chronic pain? Nobody wants to prescribe opiates anymore. They just make you could overdose on them. They make you constipated. They make you sedated. You could have falls. They're very addictive. Tylenol doesn't do much for chronic pain, except maybe hurt your liver. And then the nonsteroidals, literally 10,000 people a year die from heart attacks from nonsteroidals. And that's not including all the people who die from kidney damage or from gastric ulcers, bleeding ulcers, just from bleeding in general. Your nonsteroidals like ibuprofen, Advil, naproxen, naproxen. So when you're treating something like chronic pain, cannabis can be an incredibly helpful medicine. And the reason that a lot of doctors aren't comfortable with it is because they've been really propagandized against it over the last 70 years with their war on drugs. I wrote a chapter in my recent book that Amanda alluded to called Do Be No Harm, about how doctors were on just the wrong side of the war on drugs. And it was very, very tragic. But the fact is, cannabis never stopped being a medication. And in the early 1800s, in the late 1800s and the early 1900s, in the US, cannabis was a very commonplace medication. You could find these tincture bottles in the pharmacies, and it was used for many of the same things that we use it for today. And ironically, when they went to criminalize cannabis in the 1930s, the American Medical Association was one of the strongest voices against criminalization. They testified before Congress saying, why would you criminalize this? Is relatively harmless, not completely harmless, but relatively harmless plant-based medication that's helping us treat our patients. So I would, again, I know I'm not supposed to go on for too long as per instructions, but I would absolutely say cannabis is a medicine. And the thing is that doctors have been against it, but they're slowly coming around. The most recent data I saw said that about 2/3 of doctors are in favor of medical cannabis. And keep in mind that a particular opinion about cannabis by a particular doctor depends a little bit on his or her vantage point. Like something like 90% of the oncologists are in favor of medical cannabis because they see it helping patients with the exact same thing that it helped my brother with the nausea, the weight loss, the pain, the anxiety. And then on the other end of the spectrum are the pediatric psychiatrists who see the very rare but tragic cases of cannabis worsening psychosis. Cannabis can trigger or worsen psychosis. It doesn't cause schizophrenia, but it can trigger it in someone who's genetically vulnerable. So those pediatric psychiatrists tend to overgeneralize and think that cannabis does this to everybody, and they tend to be against it. So you can't truly generalize about doctors, except that they're eager and hungry for good information about the endocannabinoid system, the whole system by which cannabis works, and that doctors are very hungry for practical information about dosing, about the different formulations, the benefits of an edible versus a tincture versus inhaling it, because patients, now at this point, between 90 and 94% of patients believe in legal access to medical marijuana. And the doctors have to be able to talk to their patients. The patients expect and, really have every reason to expect a educated, dignified, non-judgmental conversation about cannabis like they do on every other topic you bring up with your doctor. Well, hopefully they get that kind of conversation with their doctor about all drug use and all habits and all health behaviors. So I think doctors are getting there. Patients have certainly gotten there, and that there's very little doubt in many people's minds that cannabis is a medication.
Well, now that Health and Human Services has recognized medical benefits from cannabis and we've got rescheduling on the table, what do you feel like the future holds for the development of cannabinoid-based medicines? When do you think I'll be able to walk into a Walgreens and get cannabis medicine?
Well, many of us are sort of a little bit ironically grateful that the Department of Health and Human Services are finally admitting that yes, cannabis has medical potential. When some of us have been saying this for decade after decade after decade, with the U.S. government just resolutely and steadfastly just refusing to accept even the possibility that cannabis is medicine, and also putting a finger on the scales. I mean, the US government has really only funded until recently research into the harms of cannabis, not the benefits of cannabis, because they needed to vilify and stigmatize cannabis to support their war on drugs, which everybody hopefully is realizing is a complete failure, and that getting law enforcement involved with any drug issue just makes it worse instead of better. So it's really, in one sense, gratifying that the US government is finally saying cannabis has medicinal benefit. But again, cannabis never stopped having medicinal benefit for like thousands of years. So, they're sort of, by saying that, they're sort of highlighting their previous ignorance or intransigence on the topic. But now that they're doing that, it's going to trigger a cascade of events. Cannabis has been Schedule 1, which is no medical utility and high abuse liability. That's where it's been locked away since the very beginning of the Controlled Substance Act about 50 years ago. And the fact is, cannabis has mild to moderate abuse liability, not high abuse liability. People can get addicted to it. People can misuse it. People can take too much. Nobody dies, but they have a horrible experience. They could have a panic attack. So it has mild to moderate abuse. It absolutely doesn't have high abuse liability, and it clearly does have medical benefits. I mean, the US government legalized Marinol, which is a cannabis component, in the 1980s, and now Apiladex, which is a CBD component, which is another component of cannabis, is an FDA-approved medication. So it doesn't make any sense that it was ever Schedule 1. And then furthermore, other medications that are Schedule 1 are medicines. The US government's like flat out wrong about it. I mean, heroin is a medicine in many European countries for severe opiate withdrawal. Psilocybin and LSD are like extremely exciting new treatments for treatment-resistant depression, for alcoholism, and for all kinds of other conditions. So just because it's locked in Schedule 1 doesn't mean it's not a medicine. It just means the US government's completely missed the boat on the substance. So now that it's Schedule 3, which the DEA has to go along with, it opens up a lot of possibilities for the cannabis industry, because they've been treated sort of like pariahs, because it's legal on the state level, but it isn't legal on the federal level. They haven't been able to deduct business expenses or take tax breaks or anything like that. So it's going to definitely help bring the cannabis industry out of the shadows. But what it's going to actually do for patients is a little bit unclear, because it's still a Schedule 3 controlled substance, which is like Tylenol with codeine. It's not like unscheduled or descheduled. I personally think the cannabis should be descheduled or unscheduled. I mean, tobacco is unscheduled. It kills 500,000 people a year. Cannabis kills 0 people a year. Why is tobacco unscheduled and cannabis is scheduled? And then alcohol kills 100,000 people a year and causes tons of damage with like your liver, and it causes cancer and all these other problems. And cannabis, again, isn't lethal. It doesn't kill anybody. And why would cannabis be Schedule 3 and alcohol, which by every single metric is far, far more dangerous, be unscheduled? So the question about what it's going to do to people, I think it's going to remove the stigma, and that's going to help the legalization process, both state by state. Currently, 24 states have legal recreational cannabis, and about 38 states have legal medical marijuana. So I think it's going to help propel that process forward, because it helps get rid of the stigma. The question about whether health insurance is going to pay for cannabis and whether you can get it in Walgreens or CVS, that is to be determined. It's a little bit of a weird situation where right now I, as an adult in Massachusetts or in California, can go to any dispensary and buy some cannabis. It's not a big deal. It's legal and we just buy it. But if cannabis is a Schedule 3 substance, you're going to need a prescription for it. And you're also going to need a healthcare provider to be really on board, because Schedule 3, again, is like Tylenol with codeine. It used to be what Vicodin was, but now Vicodin, they made Schedule 2 because a lot of people were getting addicted to it. So why would you get a prescription for cannabis when you could just go to a dispensary and buy it? So it's a little bit of a confusing situation where the federal government with the DEA, which regulates prescriptions and doctors and pharmacies, is completely out of alignment with the state management of it, where it's, again, legal in half the states. More than half of Americans live in a place where recreational cannabis is legal and you could just buy it. So it's a little bit hard to tell. And then finally, the health insurance companies, if I could just say one thing about that, they should be paying for medical marijuana. According to numerous studies, when they legalize cannabis, either medically or recreationally, the spending for insurance companies goes down across the board for every condition that you could treat with medical cannabis. the insurance companies, the health insurance companies are laughing their way to the bank, and they're saving so much money by people using medical cannabis instead of traditional pharmaceuticals. It's only fair that they should be covering and paying for some of the cannabis like they're starting to explore doing in other countries. So I think that's on the horizon. But as to your question about how the Department of Health and Human Services changing it from Schedule 1 to Schedule 3 is going to affect that, I think a lot of that is really to be determined.
Well, a lot of really interesting and important information. And, I think that people are looking to see what's going to happen to state legal programs should rescheduling happen. Personally, I think that governors have gotten way too used to the tax revenue to allow the state to put it back or allow the feds to put it back in the bottle. But I also know that there's a lot of folks out there that are interested in cannabis, but aren't going to consume it unless their doctor prescribes it and unless they can get it in a form that they're used to, which is probably a pill or a capsule. They definitely aren't interested in smoking. They're a little bit nervous about edibles. So, I feel like cannabis should be available to as many people as wanted. And it'll be interesting to see how the medicalization impacts form factor and who it brings into the conversation. Who is now willing to take that step and use it if their doctor is prescribing it and they're getting it the way they get a lot of different medications. So, Dr. Peter Grinspoon, thank you so much for joining us. This has been just really enlightening and I think a great service to our public watching this. So again, Dr. Peter Grinspoon, his book is Seeing Through the Smoke, a cannabis expert untangles the truth about marijuana. We'll put the link in all of our social media promos of this. And Christina, do you want to close us out?
Yeah. So, as we wrap up this medicinal escapade, remember your thoughts are the herbal remedy to our curiosity. Drop us a line at info@mypersonalplants.com and share your green musings. And for more plant-powered wisdom, don't forget to leaf through our vibrant YouTube collection. Subscribe, like, and hit that notification bell to stay in the loop. Until our next dose of wisdom, stay lifted, stay green, and keep those questions blooming.